We're hearing very positive noises. We heard Tony Holohan saying plan your summer. We heard Paul Reid saying this is the most hopeful week since the beginning of the pandemic in 2020. Where are we at?
Well, I'm afraid I'm going to have to carry on a note of optimism. So little choice, because things are looking up. We've had this discussion a couple of weeks before, and what we see as trends a couple of weeks ago, we see more definitive evidence now, and it's just getting stronger and more hopeful all the time, Ciara. So it's not just a question of the proportion of the population of vaccinated. That's impressive enough sounding there, but who has been vaccinated? It's those who are most vulnerable, those who had most to fear from the virus, those who are most likely to become ill, hospitalised, go to ITU and sadly die. So it's the proportion that has been identified and been vaccinated are the ones the soft underbelly of this disease, where we really wanted to hit hard and we really wanted to cripple this virus and the impact it's having on our country.
So there's still cases, but they're having much less impact because it's not the vulnerable who are being hit with them.
We still, of course, and the other side, of course, is, and you'll understand why I always inject a note of caution here, because we're still seeing high numbers of cases. But for the first time, we're seeing that a fracture between the numbers of cases we're seeing per day and the harm it's doing in those who are vaccinated. Up till now, it's been very, very close correlation. The numbers of cases per day would translate into hospitalisations, into ITU and deaths. Now we're seeing those two lines diverge. Excellent.
I suppose this begs the next question. If we're seeing that fracture between case numbers and cases as a metric, and then, as you say, harm because the vulnerable are protected, have we turned the corner? Is there any way to scupper it now, or the fact that, and I'm not trying to throw caution to the wind entirely, I understand that we still have to have restrictions for the next while, etc., but the fact that the vulnerable are protected now, will we ever be looking in the face of COVID in the same way as we have been? Will it ever hit here again as hard as it did?
Well, on the positive side, first of all, you've just given the answer, is those who are vulnerable are protected even to a greater extent than we would have hoped for from the clinical trials, in terms of hospitalisation, in terms of serious illness, and increasing evidence, Ciara, that we're breaking that transmission as well, that it's reducing asymptomatic illness, that's illness without any symptoms in people who are vaccinated. Some interesting stuff I saw from Chile yesterday, where they began to open up maybe a little prematurely, and they saw ongoing high numbers of cases hospitalised, ITU, in those who are not vaccinated, understandably. So we have to have a wee bit of reality as well going forward. We have protected those who are vaccinated, as I said, to an even greater extent than we would hope. But those who are not yet vaccinated remain vulnerable, particularly those people sadly in their 50s or 60s, but we're getting through them now, and we hope to have the bulk of dose ones for people in their 60s completed next week, and to be starting those in their 50s. And the further we go down those age cohorts, the more we hit that virus hard.
Okay, which is all good stuff. We're hearing that we're at almost a third of adults vaccinated and 240,000 people due to be vaccinated next week. The last time we talked, I think it was about a week ago, we were on 28% of adults vaccinated. Are we moving at kind of, and I know it's hard and all the supply issues, about 5% of the adult population per week? Is that what we're sort of seeing? So we could be hitting 50% at around the end of May?
Well, let's look. It's, as I said, there's two ways of looking at it. First of all, it's a proportion seen so far. Sounds good enough in terms of, but who were they? They were the hardest to get to. We had to remember how we started back in those nursing homes. 580 nursing homes we had to send teams into in the middle of a pandemic, as it was raging through many of those nursing homes. In hospital healthcare workers, again, we were vaccinating at speed in early January. As we now go into age cohorts, we really are shifting gears up. That's when the mass vaccination centres are opening up. 35, I think, at this stage coming this week, and that's where we start doing things at pace and at speed, and it's really going up a gear from here on out, because it's, apart from some additional groups we have to identify and vaccinate, notably people who are pregnant and those who are hard to reach, those groups we have.
And pregnant women are from next week going to be vaccinated, absolutely. Isn't that right?
But these are the last kind of small little groups, specialised groups we have to get to. Others, there's some significant numbers there. When we get to those mass vaccination centres, which are now opening up for those age cohorts, we can really put the gears up.
Colm, the over 50s are registering currently. They'll be vaccinated in the next number of weeks. They should all be vaccinated really by the end of June, when the Johnson & Johnson vaccine arrives here en masse. You have asked the HSE, not you personally, but the HSE has asked NIAC to allow some flexibility around delivering that to under 50s, or we will end up with a glut of it not being used and perhaps only used as a booster down the line. Have you had any response to your request for flexibility? It makes no... I have to... Back on the medical hat briefly, it makes no sense not to use that vaccine in under 50s.
Well, absolutely, and we've had those discussions. I know the people in NIAC, very good people, and I'm really grateful we have those experts guiding us through this and giving us independent advice. But neither do people there want to see that kind of scenario play out, Ciara. We're having those discussions this week, and I'm confident we'll get a good, sensible solution that balances the need to get vaccinated the population at speed as we ramp up, with of course safety, which is a really important part of this programme, is to reassure people that we're administering vaccines safely, not just effectively, but safely to our age groups, different age groups.